Hello everybody, Luke here. This is part 2 of our basic massage protocol for beginners. So this will be a demonstration for the prone position, prone meaning face down. This is Sarah, my girlfriend. She'll be our client today. So, in this position, first off, the bolstering. You can't see it, but I have a round bolster for underneath the ankles. There is a small pillow / bolster at the hip / low back, so she's laying on that just at the belly button area. That keeps the spine flexed, and it's very helpful for when the client's laying face down like this to utilize that pillow so that the spine isn't put into hyperextension. And there's also an additional bolster. In this case, it's a fleece blanket that's rolled up so that it just helps protect the lateral side of the body. And then I also have that blanket available for when I turn her on her side. I use it as an additional one for warmth, but actually I use either the blanket or towel to help me with draping once I have a person laying on their side or face up. So our protocol. And I have my list to make sure I even keep my own mind straight. So for each body area, we will be undraping the area. So in this case, I'm starting at the low back. So we undrape the area, make contact, and then with this, I begin what looks and feels like massage, but my goal is just to move the skin and superficial fascia. With this, you will see kind of, if I can, there's a tendency towards maybe a little bit of a grip and a pull of the skin. I never want that to be pinchy, so I want that to be utilizing the whole of my palm as well as all 4 of my fingers. And with this, I am not curling my fingers into the palm using my finger strength. My hand is making contact with the body, and I'm letting my palm push the skin and superficial fascia into my fingers. So it looks like I'm gripping, but I'm still using my palm to push the tissue, not using my fingers, not using the finger strength. So first part, make contact, move the superficial fascia in every direction. It doesn't matter. It looks a little bit like a knead, a little bit like a glide, pushes and pulls and twists. Now, once I do that, we apply lotion. In this case, I have the cream. A pump bottle is sometimes a little bit easier because you can just reach and use the pump. So here, we apply the lotion to the area in general. This is where if I'm gonna do one of those more broad sweeping strokes that just, in this case, it's meant mostly just to feel good. You can kind of, it looks pretty. But the idea, frankly, is just a way to spread the lotion on the tissue. After that, my first application will always just be a good static compression. I work my way here with that initial moving of the skin and superficial fascia with no lotion, as well as the application of the lotion and moving the tissue around. As I applied the lotion, I know I've warmed up that first layer of tissue. So now my thought process is going to be applying compression and wanting to feel like I'm in that first layer of muscle. Then after that, I'm going to work a little bit deeper, but I'm going to do my pressure check-in, one mentally. I already indicated I thought about the first layer of tissue, the skin, superficial fascia, the first layer of muscle, and then maybe now the second layer of muscle. But I can never lose my own self in terms of what I'm thinking. I have to always check in with the client to make sure the pressure is optimal for them, not too much or too little. So the easiest thing to do with this is get yourself set with your compression and slowly apply more pressure, and then have the client tell you when it's just perfect. So I get myself set, get my body mechanics oriented, get about, I call it a level 2 pressure because I'm past the first layer of tissue. I'm in the first layer of muscle. And then I ask her to tell me when the pressure is just perfect. So I'm going to apply and you say when. Just there. So I was already pretty close. So regardless if I, as the massage therapist, think about working in deeper layers of tissue, I always have to modulate that based on the comfort of the client. So in the event an area is too sensitive to work all the way to the third layer of muscle, then I just don't do that, right? Okay. I'm going to start that all over again. Here we are in prone. And then with that, you saw me do it there at the end. So what the protocol will be is undrape the area, make contact. I already have lotion on, but be contact with the area, no lotion, move the skin, superficial fascia. Compression with a pressure check-in. Then we take that compression, we turn it into a glide. 3 glides. 1, 2. In this case, I go this way, switch my arm. 3. Then 3 knees. With the back, you're better off, and in general with knees, you're better off making these knees big. Don't make them too small. That's actually way harder on your hands. And frankly, it's less comfortable. If you need very small, you have a greater likelihood of pinching the skin, and that doesn't feel good. So big knees, hands not too close together or too close together. Not too close together this way or this way. I spread them out and go forward and behind. It's not quite the right terms, but it almost makes sense. So at least 3 knees, maybe more. If I just change where my feet are, where I'm standing, that's naturally going to get a different stress into the tissue. And then from that, some kind of joint movement. Here at the spine, this is general rocking is going to facilitate small rotations at the spine in the disc space. So when I'm in other areas of the body, you'll see that joint movement aspect look more like this. In that, when I get to the hamstrings, it's going to be that whole undrape the area, make contact, move the skin. You can see, you can't see my hands particularly well, but then then I would apply lotion, glide, 1, 2, 3, 3 knees, 1, 2, 3, and then joint movement. So with the joints of the limbs, it's going to be easier to see. At the torso, I am going to be thinking of that joint movement in relation to the spine as well as the scapula, but it's just simply easier in these demonstration videos to see when it's related to the limbs. So moving the knee back and forth, I can grab the tissue and oscillate and move that too. That creates a much bigger movement that translates all the way up the whole body. So if possible, I tend to grab the tissue and do a little oscillation while applying joint movement, if possible. There's many ways I can do that. I can just grab the hamstrings and move the tissue back and forth as I'm bending the knee, grab the calves, rock that back and forth. I can even just hook around the foot like this and do more of a general oscillation and shake. So, but ultimately what I'm trying to do is make contact with the skin, move the skin and superficial fascia, glide the tissue, knead the tissue in various directions, and then move the joints. So, okay, starting. Undrape. Yeah, I almost applied lotion again. Make contact, move the superficial fascia. Okay. Get myself set. Apply compression. Then pressure check-in. You tell me when it's just perfect. Right there. And I'm going to turn that into a glide. Now my glides are pretty slow, so you might not be able to see them very well when I'm using a forearm. That was 1 glide, 2, and switch. I'm going to sweep up. I'm looking for the posterior superior iliac spine and the spinous process. My focus right now is the deep lumbar, erector spinae, and lumbar dorsal fascia. So that whole thing I did in the first video of setting my elbow, flattening my arm out, and then trying to draw the tissue away from the pelvis up toward the head. Pressure check in again when I do this. Is that pressure good?
Mm-hmm.
Now I'm gliding, but it's going to be very slow. It benefits you greatly starting out to slow down. When we get to other concepts of really helping each layer of tissue function as well as possible, the slower we go and actually the less lotion we use, the more of an effect we achieve. So, did my glides needs. Here's my joint movement. Working my way up to the mid-back / scapular region. Contact. Moving the skin. Superficial fascia. Okay, now I'm going to turn that into a compression. Okay, I'm going to go a little bit deeper. Pressure check in. Is that good? Or we need to tell me when it's just perfect. Good. I'm going to turn that into a glide. 1, 2. I will switch arms, and that'll be my third. Then we'll transition to knees. Knees here are harder. Sometimes it's more of kind of a series of small glides between the shoulder blades and the spine, between the shoulder blade and the spine, that it feels good, and at least it's an angular direction that is different than the ways I was going prior. So some areas are easier to knead, some are harder. So then, now it's going to be hard. I'm going to be working around the body just so you can see it more effectively. But my pattern would be low back, mid back, shoulder, then this side, same side, upper arm, lower arm, hand. Then I would come all the way around, and a great way to get a good pull into the shoulder and scapular areas to just grab here at the upper traps and pull. But it's going to be harder for you to see. So, but my routine is that. Start here at the low back, work my way up, go to that side arm, and then come around, and then do it all over again. So this side low back, up to the shoulder, and then work this arm. So we're going to assume we've done this side of the low back, done this side of the back, and now we're here at the arm. Now repositioning the client does facilitate joint movement. Her arm was here with the arm essentially in extension. By moving it here, I actually abducted the shoulder. I flexed the shoulder, laterally flexed the shoulder. Abducted the shoulder. There's some flexion of the shoulder, but flexion of the elbow as well. So just by repositioning the client, I'm already getting some joint movement. A way I can combine some joint movement while working in the shoulder area is here. As I'm applying a gliding stroke between the spine of the scapula and the spinal vertebrae, I can just kind of rock that arm back and forth. I'm not trying to go to end range, just doing a little bit of rotation that's going to facilitate friction and a change of shape in the tissue as I glide over it. That also allows me to easily transition to the arm itself. So here, this position, as long as it's comfortable for the client, is much better for us. When the arm is here, we can more easily hit the nerve and or artery. So by positioning the arm here and working in this direction, it's safer. So same thing, contact, moving the superficial fascia, and I'm going to translate that to some glides. Starting my compression, pressure check in, That's good.
Mhm.
As I said in the earlier video, after a while, you do not have to check in with the client for pressure every single time. But until you build up your confidence in your palpation sensitivity, get used to being able to comfortably engage and make sure that the pressure is, one, most importantly, not too much, but then is also that it's enough that it's satisfying for the client. So there were glides in that direction. Now if I come around, see, make sure you can see this, I can also apply glides that go more parallel. The idea of working, doing plus signs and X's. And bring the arm up, the side, same principle. Make contact, move the skin. It'll look like a knee. In this case, if I don't need to apply lotion, I don't. If I feel like I can get a glide without applying lotion, then I don't. That allows me to get more drag in the tissue, which means it's going to be more effective. And then it also just saves me, maybe it's a small amount of time, but it saves a little bit of effort. So there'd be a pressure check-in. I can tell I'm in the right layer of tissue. I know that I'm still in the range of pressure that would be satisfying for this client. The other aspect to always reinforce with your clients is in the event that the pressure is ever too much, that they notify you immediately. Usually make a little joke, just say start screaming until I stop. But you want to make sure that you tell the client that they need to dialogue with you. Not just in terms of pressure levels, but even in terms of like targeting a spot that they want you to focus on. So with this, let's say a glide, 1, 2, and 3. Then knead, 1, 2, 3. And I'm going to work into the palm and the hand. Using a soft fist here works really good. I protect the thumb, so I have my hand around the thumb, and I'm able to apply compression with the fist. And I just change my direction, my whole body's direction, in order to facilitate changing the stress that I'm putting into the tissue. So by me shifting my whole body, basically, I'm then getting a different angle on the soft tissue of the hand and the muscles of the hand. Okay. And we drape. Well, with that, what did I forget? Confirming that I get joint movement. Now, I showed that in the course of that, by rocking the shoulder back and forth, I achieved that while working at the shoulder. The elbow was bent back and forth just in the repositioning. The hand and the wrist was moved during massage application, and I'll be sure to move the structures, the joints of the wrist and the hand and fingers more when she's supine. So I'm going to save some elements for other positions because it's my routine and it's more convenient. Oh, see, I gotta get her back here. There we go. So reinforcing for the back, low back, mid back, shoulder, arm, then come all the way around, do it all over again. And then that transitional stroke that I have here, it feels good, but it also helps me just get back to the other side of the table. So if I've ended here at the hand, then I come back up, make contact with the shoulder, come all the way around the other side of the table. That way the client knows where I'm at, I'm still making contact, doing massage. And then here I can do this nice pull on the upper traps. Reset. Do that again. If that was the first side of the body that I worked on, then I'm standing right here to work on the other side of the back. In this case, since I've finished here for the whole upper body, now I'm standing in a perfect position to work on the hip. So here. In this case, you do need to be good at draping the hip area. For the most part, I am able to work over the sheet in this area, whether it be posterior, lateral, medial, or anterior. So for the hip flexors, glutes, deep lateral hip rotators, I usually can just work over the sheet. So here I'm going to use a good forearm. There we go. Now you got to do your pressure check-ins here. Now in this case, since I am working over the sheet, there is no lotion. So this is going to be just compressions with joint movement. This is a regionally specific thing that I do in this routine. So pressure check-in. Okay. And then with this, I'm not taking the hip joint to end range, but a little bit of movement back and forth is facilitating creating stress into the tissue right where I'm pushing. So right now I'm pushing on the upper aspect of glute maximus. By changing the orientation of the hip joint, that's going to lengthen and shorten the fibers of the muscle itself. It's going to create some tension and friction forces into the fascia. So by doing this compression plus joint movement, it accomplishes a lot in terms of changing the shape of the tissue or getting everything to loosen and free up. But there's another aspect here where clients can be uncomfortable with the idea of maybe getting the hip area worked on. If we include this joint movement, the sensation is such that it makes more sense. It feels like a more therapeutic application. Essentially, it reinforces the fact that we're doing this application for the health of the hip joint. And so it's just, from the mental standpoint, in my experience, is more comfortable, particularly for first-time clients. And I always reinforce that before the session begins, I confirm, one, it's okay to work around the pelvic area, but I even tell them with first-time sessions, I work over the sheet, use a forearm, and include joint movement, because it's very important to make sure the hips move good so that your back can move better. I didn't say that the best, but essentially reinforcing the importance of the hips. Mobility is going to affect their low back, and since the low back is by far the most common thing we will see in relation to there being some kind of dysfunction, that's working in the hip area is something we have to get comfortable with. Now, it might be a little bit hard for everybody to see, and I just messed up a little bit. I applied lotion before just making contact and moving superficial fascia. In the event that you apply lotion, you have applied too much lotion, just use the sheet. I just take the sheet, kind of like I re-drape the area, and do some mild compressions over the sheet. That will get enough lotion off where I can get that grip and drag on the skin again, so that I can work on that tissue more effectively. So in this case, I've moved the skin around. This is one of those where you can just be creative. In this case, I'm going to move the skin and superficial fascia of the whole leg first, and then apply lotion to the whole leg. That helps me with the time management aspect of this. So, we made contact, moved the skin superficial fascia, I've applied lotion. You can see that looks all very similar. One is just no lotion, one is with lotion. Now, in this case, I'm going to include some joint movement as I do my glides. You could just separate this. Start here, 1 glide, 2 glide, 3, and then go to knees, 1, 2, 3. Bend the knee, little oscillation. Return the knee, slash the leg to the bolster position, and then to the calves. 1, 2, 3. need 1, 2, 3, and then that joint movement again. But maybe here, I change and think more about the ankle as well. So ankle movement, could grab here and do that whole, like moving the entire leg. Now, to show how I normally do this, I include the joint movement while I do the glides. So in this one, I reposition the client so it's a little bit easier for me. And if I just hold her arm here, hold her leg here, then I can do a little bit of knee flexion and extension as I'm doing those glides. So 1 glide, 2, and 3. Turn the leg, go to my knees, and then transition into working on the calves. So it's one of those where I'm giving you guys a framework, but know that as time goes on, you might start mixing it up based on what part of the body you're working on and what is just convenient at the time. So then in this position, if I'm going to work on the foot, be mindful of your body mechanics the whole time. So with this, I'm going to actually work on the other foot so you can see it just a little bit better. If you're going to do the majority of the foot massage in this position, get yourself set where you're on an angle with the arch of the foot, not standing directly at the end of the table in line with their body. It will make it harder on you. If you shift to where you're basically aimed, your body, your sternum, where you're looking, is aimed towards the arch of the foot, then you'll naturally be able to apply pressure without twisting and messing with your body mechanics. And that's where most of your compression is going to want to be focused, is into the arch of the foot. Endangerment sites here are what we call, the heel and the ball of the foot. That joint of the big toe, you don't want to put too much pressure there. And there just isn't a lot of muscle tissue here at the heel, just under the calcaneus. There's connective tissue, but applying direct compression doesn't usually feel good. If I do anything there, I squeeze and kind of try to pull that tissue in one direction, and I'll come around and squeeze and pull the tissue in the other direction. For me, if I work here at the foot, it naturally, you won't see me standing here at an angle because I'm going to use my forearm. My forearm, if I bend, naturally just fits in orientation to the arch of the foot. Now with the foot, the whole idea of doing small kneads and stuff doesn't make a lot of sense. So my personal routine is just to work on the foot in multiple positions. I work on the foot a little bit here in prone, and then when I turn her sideline, I work on the foot that's on the top leg, and I work on the foot of the bottom leg. By working on the feet from those 3 different angles, I basically get a stress into every layer of tissue, and I move every joint of the foot just by changing the client's body rather than me trying to do all of that and hit every part of it only in one position. So, reinforcing the prone routine: low back, mid back, shoulder, arm, walking around, same thing, hip, leg, foot, and then we will turn her on her side. So I'm going to stop, and then we'll see you guys on the next video.